We begin with the surging Omicron variant, which is spreading at a rapid rate in the United Kingdom. Health experts warn that it's the most significant threat to public health since the start of this pandemic. And on Wednesday, the UK recorded its highest ever daily number of cases, more than 78,000. DW correspondent Charlotte Chelsom-Pill reports from London.
Festive cheer on the streets of London, once again ringing hollow. Shops and hospitality may all be open. Christmas parties still allowed to go ahead as planned. But COVID is casting its dark shadow over the days ahead. As experts warn, the Omicron tidal wave is coming, and it's coming at a phenomenal pace.
What we know is that it reproduces very, very fast. A week ago or so, we said it reproduces every 2 to 3 days or 3 times a week. And putting it very simply, that means in 1 week, you get 8 times as many infections, 2 weeks, 64 times as many, 3 weeks, 512 times as many. So it's coming at us like an express train.
The UK is already recording record COVID cases, with Omicron now the dominant variant here in London. Resisting calls from some for further restrictions, the government's focusing instead on its booster campaign, resulting in lengthy queues at vaccine sites across the country.
Obviously, the Omicron is growing so rapidly in London, and we just wanted to get in as quickly as possible.
So many people that I've heard of are getting COVID again. From last week, there was an office party of 40 and 16 of them got COVID. Clearly, Omicron is really spreading quickly.
It's very relevant or very important for me to come here today for all 5 hours. Not that I want to make an issue of it, but I live with my mother and father, who are in their 80s.
I wanted to ideally get it done before I went to go and see relatives and people over Christmas. I can't feel my toes though, but it's okay. It's okay.
The government's throwing the doors open to every adult in England to get boosted by the end of the year. They're hoping to offer up to 1 million jabs a day, as early data suggests the third vaccine is key to combating Omicron.
This is a massive undertaking for the health service. They're being asked for another major vaccine push to try and prevent hospitals like this one from being overwhelmed. But there are concerns it won't be enough. As people here line up for their boosters, there are already people in hospital with Omicron.
Hospitalisations are climbing, and one person's confirmed to have died with Omicron. While it's not yet clear how severe the variant is, the sheer number of cases alone could prove overwhelming. In the shadow of this vaccine centre, a reminder of what's at stake. A memorial wall commemorating the tens of thousands of lives lost to COVID. And it's with the pain and sacrifice of the past that this weary nation is now facing the threat of another worrying winter to come.
Our next guest is Danny Altman. He's a professor of immunology in London, and he joins us now. Mr. Altman, thank you for taking the time to speak with us. I want to start with the report that we just saw, where Charlotte outlined the very severe situation that the United Kingdom finds itself right now due to the Omicron variant, which is now the dominant variant in London. Based on everything you've seen so far, do you think that this British government has done enough?
I think scientists and experts were pleased to see them doing something and going to their plan B, so in other words, more behavioural measures and greater emphasis on boosting. Whether we've done enough, only time will tell. This looks really, really serious, and we probably need to do more.
Do you think that the fact that they lifted the mask mandate some time ago, which then now they've reinstated, do you think that that hurt efforts?
I think it did. I think, we have this discussion, don't we, about whether this is all about vaccine boosters or whether it's about vaccine boosters plus all the behavioural measures like masks. And the answer is it's absolutely about both. In this country, we kind of had our Freedom Day and took our foot off the gas. And now we need to revisit some of those choices.
The Freedom Day that you're referring to was announced by Prime Minister Boris Johnson back in the summer, where all the restrictions were lifted, and he said we're going to return to normal. And clearly that hasn't been the case, and it certainly isn't the case now leading up into Christmas. What is your biggest concern, Mr. Altman, now in the United Kingdom as we approach Christmas and potentially more travel?
Well, your item has covered the terms, hasn't it? Like a tidal wave, an express train. And that's what's coming to us. It's coming to much of the rest of the world. And something that's so infectious and spreading through the population so fast can really devastate us, both in terms of its death toll and its effect on health services.
Talk to us a little bit more about the impact on health services. Doctors, nurses have gone through much already in the nearly past 2 years, and now they're facing this Omicron variant, and some people are not willing to get vaccinated. What kind of impact could this have now in the coming weeks and months with regard to the health system in the United Kingdom?
It's so extreme. You know, we're now 2 years into this, aren't we, of a very exhausted and beleaguered and injured and overstretched health service. And I think people here, logistically aren't in a position to cope anymore, and B, simply don't have the capacity in terms of hospital beds and intensive care beds to deal with the kind of surge that it looks like we're facing.
Dr. Danny Altman, Professor of Immunology in the Imperial College of London, thank you very much for your time.
So that is the situation in Britain. But what about the rest of the world? Let's bring in Troels Lillebæk. He is the head of Denmark's Coronavirus Variant Assessment Committee. A very warm welcome to the show. Professor, Denmark has one of Europe's best virus screening programs in terms of sequencing. And in that sense, it can provide something of an early warning system for what's ahead. So tell us, what is coming for the rest of us with Omicron?
What we also see in Denmark is that the rates are doubling every second or third day. So we are seeing, a lot of testing positive every day. We have new record last 24 hours, nearly 9,000 cases, and we have also a larger and larger proportion of those cases are Omicron cases.
So breaking records, we know Omicron spreads like wildfire, but we're still not sure if it's actually more harmful than, let's say, the Delta variant. Is that correct?
Yeah, that's correct that we're not sure. But I think even if it's half as harmful as the Delta variant, the problem is the total number of cases, because if we reach a very, very high number of cases, that would be tens of thousands in Denmark. Then even if it's half as dangerous, still the total strain on the hospital system will be extremely high. And a lot of the staff members in hospital nursing rooms, all those kind of functions, they have to go home because they test positive. Perhaps they have mild symptoms, but still they cannot take care of the other ones in the hospital or those who need help. So that's a problem anyway.
So just to be clear, the biggest threat that we know that it could be coming with Omicron is that you'll have too many people infected at the same time. Even if it's not as serious, some of those will be showing up in hospitals and all overwhelming the hospital system at the same time.
Exactly. Yes, that is the problem. So we do not know if it's causing less disease than Delta, but you could say it doesn't really matter, because if you get all the cases at the same time, then you have a very severe problem. So that is what we are trying to avoid right now in Denmark by very, very huge vaccination campaigns. We have different measures in place and do all kinds of things in order to not have all the cases at the same time, to get distributed on more days or weeks, so to say.
And let's talk about those campaigns, because we keep hearing that vaccination is key. Also, now that 2 jabs aren't enough against Omicron, virologists are urging everyone to get a 3rd booster shot. But is that really the best strategy, given that in many countries, especially in the global south, the majority of people haven't even had their first jab?
No, I think what we know now for certain that when you get your booster dose, then you have a good effect about symptomatic infections, and you have a good effect about hospitalization. And what we all fear, that would be to get hospitalized, to get severely sick. So I think that is the best weapon. Also because it seems that Omicron spreads very easily. So it will be difficult to avoid this variant just by restrictions. You still need the restrictions not to get this very, very high peak at once, or at least trying to avoid it. But I would say that vaccinations is the best defense. Even after 2 vaccines, it seems that there is some effect against serious disease thanks to these memory cells. So it's not all about antibodies, but vaccination are certainly the key.
Now, one of the kinds of restrictions that governments are imposing is to try and limit movement. We learned today that France is restricting travel from the UK to try and curb the spread of Omicron. How much good is that going to do? Can we not already assume that the variant is all over Europe and could become the dominant strain here soon?
Absolutely. I think the variant is already there. I think it's a matter of how much you look after it in the society. In Denmark, we do 200,000 PCR tests per day, an additional 250,000 rapid tests. And remember, we have a population of 5.8 million, so that's nearly 500,000 tests per day. So we discover Omicron at a very, very early stage. And in the beginning, it's doubling from 2 to 4, 4 to 8, 8 to 16, and so on. When you have a Delta outbreak at the same time, you will not discover the initial doubling. So I think that's happening in many European countries unless they monitor very closely what is happening on all the positive cases. So at some point, suddenly, Omicron will peak through the Delta cases. So I'm sure that is happening most places in Europe right now. You see it in Norway, you see it in UK, you see it in Denmark, where we do a lot of genotyping and do a lot of PCR, the whole population tested nearly every week or something like that. So it's already there. I don't think travel restrictions is the way to go now. It doesn't really make any sense.
Troels Lillebæk, the head of Denmark's Coronavirus Variant Assessment Committee, thanks so much for coming on the show with those insights.
You're welcome.
Now, for a breakdown of some pandemic developments elsewhere in the world. South Korea has authorized its toughest pandemic restrictions to date. Starting Saturday, private gatherings will be limited to 5 people. Schools will go back to remote learning, and restaurants will close by 9 p.m. And here in Germany, there are plans to buy 92 million vaccine doses for the new year. The announcement comes after the new health minister warned of a jab shortage in the first quarter of 2022. New Zealand says 90% of its eligible population is now fully inoculated. The nation's health regulator has also granted provisional approval for the Pfizer-BioNTech vaccine for 5 to 11-year-olds.